Hi everyone, my name is Mabrouk, and today I'll be presenting to you on behalf of my team about our recent work on multimodal local physiological sensing on the IV site, where we aim to automate IV infiltration detection. First, let me start with a quick background about IV infiltration and its impact on hospitalized patients. IV therapy is the delivery of medication directly to the bloodstream through a catheter inserted into the vein. With subject movement and weakening of the vein walls, the catheter is dislodged where the infused medication is leaked to the surrounding tissue. It has been reported in the literature that approximately 25% of hospitalized patients receiving an IV therapy suffer from some sort of an IV infiltration. Extreme IV infiltrations are more prevalent in pediatrics population as they are unable to communicate pain in time, which can lead to tissue scarring and sometimes amputation. IV infiltration is usually evaluated on a 1 to 4 scale depending on the tissue swelling, skin temperature, and soft integrity. This evaluation is usually done in a manual way by a medical professional where they would perform a look, feel, and compare protocol that involves feeling the IV site for any swelling, skin stretch, or tissue damage, and also comparing it to the contralateral of the IV site. However, this method is subjective and it depends on the medical professional's expertise. It is also performed on an hourly basis, which can be too late for a time-sensitive medical emergency as IV infiltration. It also does require access to the IV site, which is not always guaranteed, especially in the operations room when the patients are covered in drapes. An automatic alternative is using IV Watch, which is a device consisting of a box that sits on the IV pole and an optical cable connecting that box to the IV site. The system uses optical sensing to measure the amount of static fluid under the skin. However, this method does add more tethering to the patient, making it a bit invasive. It does require more space on the IV site, and since it uses optical senses, it can be inconsistent with different skin colors. Our approach for this problem is to use bioimpedance, which is a non-invasive way to measure the electrical conductivity of the tissue. Bioimpedance is measured by applying a small, safe, alternating current through distally placed electrodes as shown here in blue, and measuring the voltage drop due to that current through proximally placed electrodes. Then using Ohm's law, the measured voltage is divided by the applied current to measure the complex impedance of the tissue at a specific frequency, which consists of a real and imaginary component. Bioimpedance has merit for detecting IV infiltration as static infused liquids in the tissue offer a more conductive path to the applied currents, hence decreasing the tissue's impedance substantially. For this work, we will be using our bioimpedance system from previous work. Our system consists of a LiPo battery and a battery charger to allow its use in unsupervised clinical settings, a microcontroller to communicate with the various sensors and lock their data onto an SD card for offline processing. The system also consists of a bioimpedance acquisition circuitry that uses the AD5933 impedance analyzer and a custom designed analog front end to allow performing 4 electrode bioimpedance measurements. This bioimpedance circuitry has been calibrated using our physiology-driven approach, which we had presented in our previous work, and also have been thoroughly validated for its accuracy and resolution, where it showed an accuracy of 0.4 ohms in real at any frequency, and also a resolution of less than 0.1 ohms at all frequency in the real measurements. The system also includes 2 miniaturized sensor boards that will be placed around the IV site to measure the site's position and temperature. For these sensors, we'll be using the LSM6DS3 by STM Microelectronics and also the TMP112 by TI. First, we validated our system's ability to differentiate between normal drug infusion to the bloodstream and an infiltration in an animal model by first placing the system electrodes proximally and distally to the IV site as shown over here, and then also placing an IV catheter directly into the vein. We collected data while infusing 2, 5, 10, and another 10 milliliters of saline to the bloodstream, simulating normal blood delivery. Then we dislodged the catheter and injected 2, 5, 10, and 10 milliliters of saline to the surrounding tissue, simulating an IV infiltration. As you can see here on the left, when the medication is delivered into the intravascular path or simulating normal blood delivery, we're seeing a small change in the collected bioimpedance at all frequencies compared to the measurements on the right, which when we dislodged the catheter and we started depositing that fluid into the IV site, which gave a more conductive path, hence decreasing the frequency, the impedance at all frequencies as shown over here. Next, we validated our system in an unsupervised human subject study. The study took place at the Cardiac Intensive Care Unit at Children's Healthcare of Atlanta, where a total of 9 patients have between the age of 0 and 18-year-olds were recruited. The study has been approved by both Georgia Tech's and Children's IB boards. The system was placed as shown on the figure on the right around the IV site with the current and voltage electrodes placed distally and proximally to the IV site, and the 2 sensor boards with the IMU and temperature sensors on them close to the IV wound dressing. The data was collected continuously for at least 7 hours from all subjects, and then the data was processed offline. One of the biggest challenges with using bioimpedance in an unsupervised setting is its sensitivity to postural shifts of the tissue under investigation. For example, here on the left is one example subject data of their z-axis acceleration on the top, which is indicative of their tissue position during the course of their data collection. On the bottom, you'll see also the same sites bioimpedance measurements. And as you can see, there's a significant correlation between the site's bioimpedance and its posture, where there's a variability of about 10 ohms, mainly due to just the posture movement, the tissue movement, excuse me. So if we were to just develop a algorithm that would look at the normalized change in the impedance longitudinally by just comparing the change in the impedance from the start of the IV therapy to the current impedance measurements, we would have had multiple false positives by now due to the change in impedance moving up and down consistently through time. Therefore, we developed an algorithm that removes the changes in bioimpedance, or specifically the normalized longitudinal changes in bioimpedance due to postural shifts, where our algorithm updates the baseline to which we compare against our bioimpedance measurements to get our normalized bioimpedance every time there's a postural shift. This happens by comparing the acceleration data from all 6 axes and to make sure they are within a specific window. Every time the tissue position is outside this window, a new baseline is defined, and then the next measurement, if the tissue is still in the same position, we just simply take the delta between the baseline at that position to the one before, and then we append that to our normalized impedance array. When testing our algorithm on all subjects, the data from different body positions and different body tissue, we're seeing a reduction in the data variability by about 64% on all subjects, and 98% in some cases, keeping it less than 10 ohms change per subject, which would decrease essentially the amount of false positives significantly later on when we start figuring out what our limits for fluid detection. In conclusion, we have shown in this work a novel way to pair posture data with bioimpedance to reduce the variability in normalized longitudinal bioimpedance signals. This should aid in developing IV infiltration detection algorithms and reduce the false positive percentages of the technology. Future work will include continuing the data collection and further developing our algorithms for the detection of IV infiltration. Thank you.